It turns out that the role of a licensed clinical social worker is far more expansive and integrative than many assume. It's not just about providing therapy, but about orchestrating a complex web of clinical care, social support, cultural sensitivity, and ethical accountability.
Really? Yeah, that's a lot more than the typical therapy role people picture.
Exactly. And why does this matter? Because understanding the full scope of the LCSW role is crucial for improving client outcomes, ensuring ethical practice, and optimizing interdisciplinary collaboration in behavioral health settings.
So by the end of this episode, listeners will get a deeper appreciation for how LCSWs function not just as therapists, but as clinical strategists, cultural mediators, and ethical stewards, all while delivering evidence-based care that addresses the whole person.
Right, and that whole person focus is key. LCSWs don't just treat symptoms. They integrate mental health care with social determinants, family, community, practical needs that shape daily functioning and resilience.
Yeah, and that's what makes their role so multifaceted. They serve children, adolescents, adults, individuals, couples, families, and groups, across settings like in-person, telehealth, and even community-based sessions.
It's a broad demographic and a broad scope, and the clinical practice reflects that. They start with thorough psychosocial assessments to identify needs, strengths, risks, and barriers.
Those assessments really set the foundation for everything else, right? Because from there, they build treatment plans with realistic, measurable goals that fit the client's unique circumstances.
And the treatment plans aren't static. LCSWs deliver therapy dynamically, monitoring client response and adjusting interventions to keep care effective and client-centered.
Plus, the therapy formats are diverse: individual, couples, family, group therapy, and psychoeducation. And they often use brief, solution-focused, integrative approaches.
Don't forget the Christian counseling component, which is offered when it aligns with client needs and the setting, especially in faith-based organizations.
That's an important nuance, balancing faith-based values while welcoming clients of any or no religious affiliation. It requires cultural sensitivity and adaptability.
Speaking of cultural sensitivity, bilingual English-Spanish services are a big part of building trust and engagement, especially in Hispanic communities.
Absolutely. Language access isn't just convenience. It's a clinical tool that enhances follow-through and outcomes.
And trauma-informed care is another critical framework. LCSWs recognize how trauma impacts functioning and use approaches that reduce impairment and promote recovery.
So, beyond therapy, LCSWs act like clinical conductors, coordinating care among caregivers, physicians, case managers, and other providers to keep everyone aligned on client goals.
Yeah, that coordination is complex. They connect clients to referrals, mentoring, case management, and community programs, advocating for access to resources that improve stability.
And that care coordination extends beyond the therapy room, helping clients navigate complex service systems and ensuring follow-through.
Which requires sophisticated communication skills and a deep understanding of systemic barriers clients face.
Now, documentation often gets overlooked, but for LCSWs, it's a clinical and ethical tool. They complete assessments, treatment plans, progress notes, and discharge summaries that meet Department of Public Health and HIPAA standards.
Right, and documentation supports ethical practice by providing transparency, accountability, and continuity across providers and settings.
Plus, it ensures readiness for payer audits and claims, Medicaid, Medicare, insurance, which is essential for organizational sustainability.
So documentation isn't just paperwork. It's part of professional responsibility and client confidentiality protection.
And then there's supervision and consultation. LCSWs provide structured supervision to interns, LMSWs, and clinicians in training, focusing on case review, feedback, and ethical decision-making.
They also oversee evaluations, confirming clinical priorities and refining treatment plans to keep goals realistic and measurable.
And ongoing team consultation with counselors, therapists, and primary care teams supports continuity and integrated care.
This supervisory role is vital for maintaining clinical quality and ethical standards within agencies.
When it comes to skills, clinical presence is paramount. LCSWs apply sound judgment, listen deeply, and respond with compassion to create a safe, respectful environment.
Clear communication is also essential for building rapport with diverse clients and coordinating effectively with interdisciplinary teams.
And adaptability, cultural awareness, and initiative are critical, especially in serving Hispanic and faith-based communities.
So the role balances honoring clients, cultural and faith backgrounds, while practicing trauma-informed harm reduction care consistent with professional codes.
Ultimately, the broader impact is about restoring stability, hope, and resilience. Therapy helps clients strengthen coping skills, emotional balance, and life functioning.
And LCSWs bridge clinical care with practical support, connecting clients to resources and coordinating services that improve follow-through and outcomes.
Education and support groups empower clients and families with skills for daily life, promoting long-term resilience.
Holistic, culturally grounded care fosters community well-being and aligns with the mission of faith-based organizations to serve the whole person.
So the LCSW role is pivotal, not just treating symptoms, but transforming lives within social and spiritual contexts.
Exactly. It's a demanding role, but deeply rewarding, requiring clinical expertise, cultural competence, ethical rigor, and collaborative skill.
And understanding this complexity helps us appreciate the full value LCSWs bring to behavioral health and community care.
Well said. That's the kind of insight that can improve practice and outcomes across the board.
Definitely. It's about seeing the LCSW as a clinical strategist, cultural mediator, and ethical steward all in one.
And that's a wrap. Solid food for thought for anyone working in or with behavioral health systems.
Yeah, thanks for unpacking this with me.
Likewise.